Chapter 8, Principles and Skills of Mental Health Care. Chapter Learning Objectives. Mentally healthy adults are individuals who can cope with and adjust to the recurrent stresses of everyday living within an acceptable way. Although these individuals may experience unhappiness, anxiety, or other psychic distresses, they manage to mobilize resources, rise above negativity, and carry on with their daily lives. Citizens of industrial cultures label a person as mentally ill after their ability to function independently within society has been impaired for a period of time. Within our culture, mental illness results when an individual's problems can become so overwhelming that they are unable to carry out activities of daily living or function independently. In mental health care, these specific professionals base their care on the whole aspect of the individual. They focus their care like the profession of nursing, so it's very holistic. So the main therapeutic tool for mental health care providers is the sense of self. Therapeutic use of the self can result in great improvements in clients' behaviors when the do no harm principle is applied. However, if it is overlooked or forgotten, the individual that loses is the client, the very person that we are obligated to protect. No matter what the circumstances, we avoid any action that may result in harm to our clients. The do no harm principle also relates to the reasonable and prudent nurse concept that is found in the United States law. People with mental problems suffer from socially imposed stigma. The word stigma may be defined as a sign or a mark of shame, disapproval, or disgrace, or being shunned or even rejected. Because people feel uneasy about discussing mental behaviors that are different, they shy away from mentally troubled people. One of the barriers to recovering from a mental illness is the social stigma that clients experience. Nurses should set examples by acting as advocates for these mentally impaired individuals, and nurses should educate themselves about psychiatric illnesses. The principle of acceptance is allowing others to be who they are without passing judgment is vital within healthcare, because as nurses we care for so many different types of people. The differences do not have to be understood, but as a nurse we have to accept them. We may disapprove of our clients' attitudes and behaviors, but as a nurse we must accept the person, because it is the person that is the focus of a nurse's health care activities. The word trust, this means assured hope and reliance on another. Erik Erikson's theory lists the development of trust as the first task of the individual when they are an infant. Trust is an important concept for human beings who are social and group-oriented. Trust implies cooperation, support, and a willingness to work together, and it can occur on various levels. Individuals that are unable to trust, they cannot rely on others for help. Many people with mental or emotional problems struggle with problems of trust. Trust is the foundation of the therapeutic nurse-patient relationship, and it will form the basis for either the success or the failure of all the nursing actions. Each and every behavior serves a purpose and has meanings. Behaviors are attempts to fill personal needs and goals. Each one of us lives within our own private world. Most individuals' private worlds, their internal frame of their reference, are agreeable with others. However, when individuals have mental or emotional difficulties, they have private worlds that may be difficult for the average person to understand. Behavior actually consists of perceptions, thoughts, feelings, and actions. The disruptance of any of these can result in behavioral problems. Distorted perceptions, impaired thought processes, and the alterations of an emotional expression may lead to maladaptive actions. Behaviors also must be understood in the terms of the context or setting where they occurred. An often overlooked method of understanding the meaning of a client's behavior is to ask the client. Many of the clients are willing to share with a nurse. When the client has a trust in the nurse and the nurse is willing to take time to listen. Reasonable people. These are individuals that are capable of making and fulfilling obligations, and they are accountable for their decisions or actions. Responsibility implies that a person is able to exercise capability and accountability. Individuals who are unable to make or keep obligations are not considered responsible. Nurses work with patients who exhibit a variety of coping styles as well as behaviors. We are to encourage responsibility because it is a primary mental health intervention. Responsibility helps build self-worth, dignity, and confidence. Responsibility also assists the client in becoming more successful in their coping behaviors. Responsibility is considered a cornerstone of modern society. This is also the goal of mental health. Mental health clients can be labeled with one or more psychiatric diagnoses, but all clients have one thing in common: unsuccessful coping strategies. The very nature of a mental illness is characterized by actions that are not in keeping with society's definitions of appropriate behaviors. When experiencing stress, individuals use their resources to decrease the comfort. These efforts are called coping mechanisms, and they are defined as a thought or an action that is to help reduce stress. Everyone uses coping mechanisms as tools to help us work through the ups and downs of daily living. Coping mechanisms are labeled into three main types: psychomotor, which is physical; cognitive, which is brain or intellectual; as well as affective, which is emotional. When coping mechanisms are successfully used, an individual is able to solve problems and reduce stress. These are adaptable or constructive coping mechanisms. However, when efforts to decrease stress are used without resolving the conflict, then the coping mechanism may be labeled as maladaptive or destructive. We understand that a crisis is an upset within the homeostasis of an individual. It has several characteristics that separate it from other stressful situations. First, the definition of a crisis is an individual matter that depends on the perception of the event, the severity of the threat, and the available coping strategies and resources. Second, a crisis occurs when an individual's using coping mechanisms are not effective. Now the crisis demands new solutions with new coping strategies. Third, the crisis is self-limiting. Because human beings cannot endure high levels of continued stress, crises are usually resolved within a short period of time. Fourth, a crisis usually affects more than one individual. Everyone within the person's support system is affected by the crisis. The main goal of crisis intervention is to help people and their families manage their crisis situations by offering immediate emotional support. People are then assisted in developing effective coping mechanisms or strategies, which permits time to reorganize their resources and support systems. The last principle for mental health relates to the concept of consistency. This is displaying behaviors that imply being steady, regular, and dependable. People that have a mental illness often lack the security of someone who is there when needed. In many cases, the inconsistency and the reliability of mental health nurses are an individual's only stability. The link that serves as a bridge between the client's world and the world of reality is frequently the reliability of the therapeutic nurse-client relationship. Nurses serve as therapeutic instruments, with each interaction designed to help move their patients toward goals of care. Nurses also act as role models for good health and physical health. Nurses are expected to help solve problems while graciously coping with varied personalities of many individuals. Self-awareness is a consciousness of one's personality. It is the act of looking at oneself, of considering one's abilities, characteristics, aspirations, and concept of self in relation to others. It is an awareness of one's personal and social behaviors and how they affect others. In short, self-awareness is the ability to objectively look inside. Everyone has a universal human need for love. Maslow's hierarchy of needs lists the need for love and belonging as the first non-physical requirement after safety. Without love, infants fail to grow or thrive, and adults may become isolated, lonely, and depressed. Human beings are considered gregarious creatures. Human beings are meant to live with others. Caring is the energy on which the healthcare profession of nursing is built. It is defined as a concern for the well-being of another person, and it includes behaviors like accepting, comforting, honesty, active listening, and sensitivity. Caring is the glue that binds individuals to each other. It is the energy of the soul freely given in hopes of helping another human being. Caring cannot be taught as a procedure or a skill. Caring must be developed, encouraged, and molded into the therapeutic personality of the care provider. Caring serves as a thread that connects people and helps move them to or toward recovery. Insight is considered the ability to clearly see and understand the nature of things. It relies on common sense, good judgment, and prudence. Although not always comfortable, our insights provide us with new opportunities to take risks, explore our own potentials, and fail as well as succeed. Self-awareness is developed through the practice of introspection, which is the process of looking into one's own mind. Introspection is considered an analysis of self, one's feelings, reactions, attitudes, opinions, values, and behaviors. It is also a process for observing and analyzing one's behavior in various situations. The process of developing self-awareness includes both elements of risk and failure. If one is to grow, then one must take risks. Risk-taking implies the possibility of failure. For most individuals, the word failure has a negative meaning that implies defeat and a lack of success. Yet failure can be filled with positive, growth-promoting experiences. Failure provides the opportunity for change. The first and most important step is to understand that failure is a necessary part of change. As nurses, we know that each client must be given respect and the opportunity to participate in their care if treatment is to be successful. Acceptance in this context means the receiving of the entire person and the world in which they function. Accepting clients does not necessarily include approving of their behaviors. This is a vital distinction. As a nurse, you must accept the person, but you, the nurse, do not have to accept the behavior. Professional boundaries define the needs of the nurse as distinctly different from the needs of the patient or the client. What is helpful and what is not, and what fosters independence or an unhealthy dependence. The need for professional boundaries must be continually balanced with the nurse's need to be caring. To do this, nurses establish their own set of professional boundaries. They define the limits of both their personal and their nursing professional lives. The focus of the nursing aspect is the client, but the focus of the personal aspect is the nurse. The boundaries of each remain distinct because the nurse cannot focus on the client and themselves at the same time. A commitment is a personal bond to some course of action or cause. Nurses have stronger commitments than most individuals. Nurses are committed to caring about the welfare of humankind. Nurses demonstrate this dedication by continually seeking out new knowledge and keeping up to date with the latest professional nursing developments, and by striving to improve their therapeutic effectiveness. Distress of the human spirit can be far more damaging than a medical diagnosis. A positive, health-oriented attitude alone can make a difference in someone's functioning. As nurses, we learn to approach problems with an attitude that employs the client's strengths, assets, and resources. A focus on the positive aspects of a situation has a far greater chance of success. One's positive attitudes and thoughts can act as buffers against stress and conflict. They can burn out the nurse, the syndrome that results when nurses give too much without renewing their energy. A crucial first step in the development of self-awareness is to recognize and tend to your own needs. To nurture someone is to encourage in their development. Nurses are expected to work hard for the welfare of their clients and patients, but energy cannot be continually spent without being renewed. Nurses must function at a high level of wellness to provide the energy required by their clients. Nurses have chosen to care for others, and part of the responsibility nurses accept when making this decision was to care for themselves. To effectively care for clients, nurses must care for and nurture themselves.